Good morning, Mr. Clooney.
Good morning.
I am Mrs. Whitaker, Suzanne, and I'm going to be the nurse taking care of you today. Can you just tell me your full name and date of birth, please?
My name is George Clooney. My date of birth is June 29th, 1989.
Okay, thank you very much. I understand you came in with some weakness in your lower extremities this morning early. I'm going to put the head of your... Go ahead, I'm sorry. Would help if I pushed the right button, wouldn't it? This might help you keep breathing a little bit, okay? I'm going to look at your orders real quick and see what we're going to be doing today. So you are on the telemetry unit, and we've got our monitor hooked up so that we can see your heart rate at all times. We're going to leave you on bed rest till we see how far this paralysis is going to go. And we're going to also be checking your vital signs every hour. So I'm going to be in here with you a good bit today. I see you've got compression stockings ordered. Don't have those on yet. Okay, but I'll get those for you as next time I come out and get those going, because we want to keep from getting any clots in your legs while you're immobilized somewhat like this, okay? Oh, you get to eat regular food. That's awesome. And I'm also going to be doing some neuro assessments on you every hour. Now, I'm going to be asking you to do some weird things and asking you if you can do some things for me. And it's just so we can keep a close eye on what's going on with that paralysis. I see you've got your Foley in. Excellent. And you've got good urine output, so that's good. And we've got your D5W going over here at 30 an hour. See how this IV site looks. Any pain or tenderness around here?
No, ma'am.
Okay, good. I'm going to check that flow in just a little bit, but it looks fine. Now we may be getting you some respiratory therapy. It's going to be coming in a good bit to check on how your breathing's doing. And if we need them to come at any time, we'll consult them, and also physical therapy, because we want you to keep your muscle strength up while you're in bed. The only other thing I see on here is this little incentive spirometer, and we'll talk about how we're going to be using that every hour today too, because that's going to help keep those respiratory muscles up. I'm going to get your blood pressure while I'm doing that, and start undoing down here so we can actually start seeing how far you've got feeling and tenderness in movement. Part of that's going to be seeing how that oxygenation is going, okay?
I'm kind of hurting. Is there something you can give me?
Sure. Can you tell me on a scale of 0 to 10, with 0 being no pain and 10 being the worst you've ever felt, how you would rate that pain?
Right now I would say it's about a 6.
About a 6. Okay. Can you tell me where the pain is and describe it?
It's just kind of, I don't feel real well. I can't really tell you where I don't hurt. I just don't feel good.
Okay. All right.
And, I can't really feel my legs too well, so that's making me a little nervous.
Okay. I can certainly understand that. Your oxygen saturation's down just a little bit. So I'm going to put a little oxygen on for you and see if we can't get that up. That's not anything unusual.
Do you think this has anything to do with a cold? I had a couple of weeks ago. I was fine before that.
You were fine before that cold? Did you have a bad cough or fever? There we go.
I did. I just felt really bad. It was a bad cold.
Well, that is one of the things that can cause this viral and this infection to occur is a reaction to some type of infection, bacterial infection. So that very well may be related to this.
Oh, okay, thanks. They didn't tell me that.
Okay, so that should start helping you some, and I'm going to go ahead and talk to you about this incentive spirometer. We're going to do this a couple of times, and we're going to do it every hour, and what I want you to do is put it in your mouth and take some big, deep breaths in, and you're going to see that ball go up. We're going to set a goal of about 1,500, okay? Deep breath. Okay. Good, you did very good. Let's do that again.
It's a little hard.
It is a little bit hard. One more time for me. Okay, we're going to do that about 8 to 10 times each time, but I want to finish getting an assessment of what's going on with your movement and things. Okay, we got our setup over 90 now. So can you tell me, try to push my hands please with your feet. Good. Now, okay. Can you pull back against my hands? Okay. All right.
No.
Okay. How about feeling me touch you? Can you tell me which leg I'm touching?
No, I can't.
Okay. That's not unusual, Mr. Clooney. How about now?
No, I can't feel that.
Okay. How about up here?
No, I can't feel where you're touching me.
Okay. Let's move up here now. Can you grip my hands for me, please?
I'm trying.
Okay, I feel a little bit of grip. So you can't pick your hands up off the bed, though? Just a little bit.
Not very well.
Okay. How about now? Can you feel my pen? Can you feel where I'm touching?
No, I can't really feel where you're touching me.
Okay, okay. So with this disease, the paralysis is going to ascend up. So it's not unusual that it's just your hands right now. You could grip a little bit. Now that may go away. It may be that you won't be able to do that. Excuse me. But that's why you're in this unit, so that we can keep an eye on that. Your blood pressure right now is good. It's a little bit high, so I'm going to try to get your medication started and get you that pain medication that you need.
Okay, thank you.
Let me ask you a couple of questions too. You know, I told you I was going to ask you some weird stuff. Can you swallow okay?
Yes?
Okay, good. Can you shrug your shoulders for me? Good.
Yes.
Okay, good. How about stick out your tongue? You had a lady ask you to stick out your tongue before. Let me see you stick out your tongue at me. Very good. Very good. And you're swallowing fine, so you have a good gag reflex. All right, so I'm going to be asking you those questions. If you have developed any problem with shrugging your shoulders, you let me know. Give me a big smile. Very nice. Yeah, good. Okay, thank you. All right, you do have an order here for something for pain. Before I give that to you, though, I'm going to finish my assessment so I'm sure that you're breathing okay. So I'm going to need to listen to your lungs. Oops, I left my pen light on the other side. I'm just going to be shining a little light in your eyes. And you just look straight up at the ceiling for me. Good. Very good. All right, can you see the pen? Follow it in for me.
Okay.
Good. Now, without moving your head, just follow the pen as I move it. Excellent. Good job. Thank you. Okay, open that mouth and let me hear an ah again.
Ah.
Very good. Nice and moist so you're not dehydrated. That's good. Okay, that looks good. Let me take a little lesson. Listen here. You just breathe in and out for me. I'm going to listen to your lungs first. Okay. I'm just going to be listening to your heart.
Ma'am, can I get some of that pain medicine, please?
Yes, sir. You give me one more minute. I'll get started on that. Okay, that is all sounding very good. Any problems with your bowels?
No, no problems with my bowels.
Okay, good. Good bowel sounds. Good. And no pain as I move it around?
No, I don't have any pain when you're mashing on me like that.
But that other
I have a
pain.
question to ask you.
Oh, okay. What's your question?
Well, you told me about this Guillain-Barré, and that I'm gonna not be able to feel my feet, and it's gonna work its way up. So my question is, am I gonna be on a ventilator? I mean, I don't really want to be on a ventilator.
I
had a
understand
cousin that was on a ventilator,
Right.
and they never got off. Is that gonna be me?
I understand your concern, Mr. Clooney, and Guillain-Barré, that's a possibility that you could end up on a ventilator, but the majority of patients come right back off of that as soon as this progresses back down. That's with Guillain-Barré because it comes up and you might have paralysis and we might have to ventilate you, but it will go back down as the disease is leaving your body. So that's why you're in this unit, and we're going to be right here with you. But I do know that's a scary thing to think about. How about I get you that pain medicine?
Worried.
Okay, you ask any questions you want to. So we do have some pain medicine here for you. Let me scan your armband.
Now they said something about a test or something I was supposed to go down for. Do you know a little bit about that?
I do. They are going to do a lumbar puncture, which they will roll you over and put a little needle to remove some fluid from your spinal column. And they'll put a little deadening there so that to help with any pain you might have from that. And then they'll test that fluid to see if you have any proteins. That helps to confirm the diagnosis that we have. I'm going to get you to sign that consent here before I give you this Dilaudid, because we want to be sure that you're lucid when we get you to sign that you know what you're signing.
Oh, okay. Well, is it gonna hurt though?
The lumbar puncture?
Yes, ma'am.
It is mostly pressure. You'll feel pressure up against your back. I'm not going to tell you that it's not going to be completely without any feeling, but it will be a sense of pressure mainly that you feel there.
Okay, thank you for letting me know about that.
You're welcome. Where's my Dilaudid? Alright, so we get 2 milligrams of Dilaudid. And I have 2 milligrams per milliliter of Dilaudid here. So I'm going to pull up an entire milliliter. I'm going to mix it with some saline so that I can give it over 3 to 5 minutes easier. And I've got a piece of tape here that I'm going to mark it with Dilaudid. 2 milligrams. And place it on my syringe. So that I know exactly.
Now, I know you told me I wasn't going to be on a ventilator, but am I going to get this again? Or how long is it going to take before I get better? I have to get back to work.
Well, those are some great questions, Mr. Clooney. The odds of you getting it again are low, but people have gotten it more than one time. But generally, no, you do not have it more than this one time. And as for how long it lasts, once we know how far that your paralysis has gone, it will stop there for a while. That could be a couple of days, it could be a couple of weeks. It may stop down here below the nipple line and you will not have to be on a ventilator. So we're going to keep assessing you for that while we're working today and working with you while you're in our unit. And I'm getting ready to hang some medication that is going to help with stopping the progression of your paralysis. So I'm going to need you to tell me your name and date of birth one more time, please.
My name is George Clooney. My date of birth is June the 29th, 1989.
All right, you are who they say you are. Thank you. This was sterile.
Did you ever get me that pain medicine?
That's what I'm about to start. Before I get that started, because I don't want to mix the two, I'm going to give you the pain medicine. I've got that ready to go when we get through with it though. This is your Dilaudid, and this is just a flush I'm going to use from this closest port. I'm going to go ahead and flush it. Even though you've got a line going, I want to be sure we've got a good IV site here. You may taste, some people say they taste a little salt when we flush. Okay. And I'm going to push this over about 3 minutes. This is your pain medication.
Okay.
Do you have any questions while we're doing this?
I mean, I know you told me I wouldn't be on the ventilator, but I'm really anxious about that.
I understand that. I would be anxious about that too. You know, the big thing that we want to do, as I said, I'm going to be assessing you constantly. I'm going to be asking you those weird little questions about, can you shrug? How are you doing with that? Can you still shrug okay?
Yeah, I can.
Good, good. And how about your swallowing?
Yeah, I can still swallow pretty good.
Good. I've got a pill here that I'm also going to give you, and you're going to have to swallow it. This is a 600 milligram pill, but you only need half of it. Okay? So it won't be quite as big to swallow, but I want to be sure that you are able to swallow. You know what I didn't do? I told you I was going to get you to sign that consent form, and I forgot to do it before I started this Dilaudid. So we will get that done in a couple of hours. You're not going down till this afternoon sometime, so we'll get that done before you go down.
Okay. Will this medicine maybe help me sleep or help me with some of that anxiety? I just don't even want to think about it.
Yes, sir. Yes, it should. It might make you a little sleepy.
Okay, and then what was that stuff you said you were gonna put in my vein?
That's Gamunex, the IV piggyback, the other medicine.
Yeah, I haven't gotten that before. What's that for?
Well, it's an IVIG medication, and it help your immune system work better so that you can fight off this infection better.
Is it gonna hurt?
No, not at all. I'm not going to have to stick you again or anything. I'm going to just go ahead and get it started. I hooked it up now, and I have 30 grams in a 100 milliliter bag. So I'm going to let everybody do the math, but I've done my math. Pause the video. And then we're gonna do basic secondary and put our rate in at 15. My volume to be infused is 100. And I'm gonna start. So now my secondary is running. That medicine is going well. Let me go over here and check your vital signs again since I've given you that pain medication. Let's be sure everything's doing well.
Okay.
Your sat's still at 95%. You're breathing good. You want to try doing a little incentive spirometry for me, and then we'll get that other pill, the little pill in. I want to ask you those silly questions again. Can you shrug your shoulders?
I can shrug my shoulders, but let's not do that incentive spirometer. We don't have to tell anybody.
That sounds good, doesn't it? But this incentive spirometer is going to help keep those lungs open. I know it's kind of a pain, but it really is helpful for you and helps you expand those lungs. And that's what we're worried about with this disease. We don't want your lungs to quit working, so we want to keep them open and clear.
Okay, I was hoping I maybe could
Talk me out of it.
bypass that, but yeah, I guess I can't, so okay.
Okay, here we go. Okay, good job. See, 10 of them wasn't that bad, Mr. Clooney. Your sat's up to 96.
You do that.
We're up to 96% on your saturation. Your vital signs are looking good. They've come down a little bit on your blood pressure. So let's finish getting these meds in. I've got a pill for you to swallow. This is the gabapentin. This is also going to help with some of that pain, neuropathy pain that you're having in your legs. Even though you can't feel, I know sometimes that feels like a little tingling going on. Okay, so I just need you to swallow. Good, thank you. Thank you very much. And then the last thing we have is called Lovenox. And that's a little shot you're going to be getting in your stomach every day. And that's going to work along with those compression stockings we have on down there to keep you from having a clot develop while you're as immobile as you are.
Can you give that in my arm? The nurse last night gave it in my arm, and it didn't hurt quite as bad.
It didn't. Well, it is absorbed better when we put it in your abdominal area. I'm going to go away from your belly button a couple of inches, okay, and see if I can do a good job with this injection.
Okay, can you just make sure you rub it after?
Well, that's another thing I can't do. After this particular medication, we don't need to do any rubbing, okay? But I'm just going to do a quick stick in your stomach here. 1, 2, stick. There you go. And I'm done.
Hey, that kind of burns a little bit.
It does burn just a little bit. That should go away in a few seconds. But it's important to get all that medication in there.
Okay.
Alrighty, let me make sure that we've gotten all your meds in. So we took your gabapentin, which was for your neuropathy. Got your Lovenox in. I've got your IVIG running. And you've had something for pain. How is that pain feeling now? Is that getting better? What would you rate it on a scale of 0 to 10, 0 being none?
It's probably about a 2. I feel a lot better.
Good.
Are you sure I'm not going to get on a ventilator? I'm really nervous about that.
Well, Mr. Clooney, I can't promise you that you won't be on a ventilator. But I can tell you that we're going to be watching it. And if you have any signs of respiratory distress, we will have respiratory up here to check you out and get you what you need to get better.
Okay, so I just need to call you if I have a problem catching my breath?
Absolutely. But we're gonna be
Okay,
monitoring you. You'll have somebody in here with you. Okay?
Okay, that sounds good. Thank you for explaining everything to me. I really appreciate that.
You are welcome. You are very welcome. So you let us know if you need anything else, Mr. Clooney.
Okay, is it okay if I go ahead and take a little nap? I'm getting a little sleepy.
I think that would be fine. Your saturation's still up at 97 and your vital signs are good, so looks like you're doing good right now.
Okay, thank you.
Thank you.